All right, so thank you everyone for joining today and talk about mental health and talk about what we can do with natural medicine to gain a better mental health in general. It's such an important topic nowadays, like so many people have struggling with anxiety and depression, etc. And especially since the COVID pandemic, we'll show some numbers later about it's really becoming a more and more important topic. I'll give you a bit of background about what I'm doing and who I am. So I'm a Chinese medicine practitioner. I grew up in France and I spent 11 years in China, during which I did a Bachelor and Master degree of Medicine at Beijing University of Chinese Medicine. And also I had extensive exposure to clinical practice with some of the best experts in Beijing. And then I was very passionate about getting these skills in China and bringing them back to the West or to the rest of the world, really. And then I did a PhD at Western Sydney University because I realized that research is very important to build up the field and make people more confident about what we're doing. So that's my background, really. And what I'm doing nowadays, I'm practicing Chinese medicine. I have 2 clinics, one in Westfield, one in King's Cross. And I'm also lecturing at Sydney Institute of Traditional Chinese Medicine, and I'm also conducting some research projects, mainly at Western Sydney University, in the institute called NICM, National Institute of Complementary Medicine. So that's in a nutshell what I'm doing and where I come from. Today, we're going to talk about these few different things. First, we're going to talk about what are mental health issues, so how you can detect them, how does anxiety look like, how does depression look like, etc., etc. And I will also go through what is not mental health problem and what we should not label as mental health issues. We're going to talk through the different therapies that are available for mental health, and there are lots of them. And a bit the pro and cons of these different therapies. We're going to explain like how, because everyone is different, and that's really natural medicine, what we believe. We're going to show different patterns of mental health conditions and how to detect them. And so the last part of this presentation will be how to individualize the treatment, not necessarily treatment, but management of these mental health conditions and mental health issues, depending on the characteristics of the person. All right. Let's talk about depression, which is what everyone is very familiar with. So depression is, by definition, is characterized with low mood. So people who have depression, it's completely normal to have low mood from time to time, but people who have depression, they feel constantly in this low mood. They never get to a point. It's not never get to a point, so that the mood is constantly in a low situation. They can sometimes be happy. It doesn't mean that someone who has depression can't be never happy, but it tends to be very rare compared to normal people, and they tend to fluctuate much less than normal people. Depression people have also a lack of interest. So these two symptoms, low mood and lack of interest, are the 2 main symptoms of depression. And if you want to be diagnosed with depression, you need to have either one or the other. Okay, so lack of interest, it can be
Come on, just move over.
Is there a question or no? Okay, it was just a background noise. All right. So lack of interest, it can be just lack of interest.
Move over that way.
Hello, are you trying to ask a question? No. Okay. Yeah, so it can be just about, for example, going to work, having no interest to go to work and feeling it's a burden. Lack of interest in cooking. Some people just like cooking and suddenly they don't feel like cooking is something interesting to them. lack of interest in people. So that's also a very common one. People who are very involved in their looking after the children, looking after the family, etc., etc. And suddenly they don't feel like doing the things anymore, or they're not interested anymore. So that's also a very important sign of depression. Interestingly, some people don't have low mood, but they just have this lack of interest. Third one is lack of energy. It by itself, lack of energy is not a sign of depression. It's really when you add it up to low mood or lack of interest. Okay, so lots of people feel tired. It doesn't mean they are depressed, but we do see a lot of people who have depression who have this lack of energy. Does that make sense? Okay, fourth one, I think I see a lot in the clinic is rumination. So rumination is about thinking about the same thing again and again and again. And generally it's negative thinking, right? So it's the same idea, or I'm such a failure, I'm such a failure, I'm such a failure. It's just coming back again and again. And that's something that we see a lot in depression. Depression is kind of a state that a lot of people who have mental health issues, it can be obsessive compulsive disorder or anxiety or other type of stress-related problems, they reach that stage of depression when they get stuck in this mental status, or where they think about the same thing again and again, and bringing them to a lack of moving, lack of changing, and etc., etc. Now they have two different types I see in the clinic. The first is the people who are more anxious. So obviously they have a lot of anxiety. They're very high, they're very hyper. So they're very agitated. The mind is racing. They also have a lot of appetite. They move relatively fast and they don't sleep that much. So that's the more anxious type of depression. Now, the one we may be more familiar with is the lethargic type of depression. So it's when people are not moving, they just stay in their bed or in the sofa all day long. They have low appetite, slow actions, and they sleep a lot as well. People who have depression, they tend to have bodily pain a lot. So it can be pain in the it can be headaches, it can be pain in the shoulder area, trapezius area, it can be pain on the side of the body. It can be pain pretty much everywhere. And when they do x-rays, they find nothing. So it's not an organic problem, it's a functional problem related with the depression. Anxiety, by definition, is it's a fear about something very vague, okay? Which is different from fear, because fear is about something very specific. For example, if you see a snake in your garden, you freak out, and that's completely normal. That's fear. That's how you're supposed to react. Now, anxiety is something much more vague. So I'm very worried about my work, but I don't know what exactly I'm worried about. I'm just worried about something's going to happen. I'm worried about my children. I'm worried something's going to happen to them. But I don't really have a good reason to be worried about. Okay, so that's anxiety. Some people, they can't tell you at all what they are anxious about. They just feel anxious. They have no idea about what they are anxious. They just feel anxious, that's all. People who have anxiety tend to feel keyed up. So they feel very agitated, very high. The brain is working very strongly. They tend to have sympathetic symptoms. So sympathetic is the autonomic nervous system. It's a nervous system that is regulating our organs. And because it's regulating all our organs, it will have influence on our heart, our lung, about the gut, etc., etc. So people who have anxiety, they may have palpitation, they may have very shortness of breath, they may have dizziness, they may have problems in their digestion, etc., because these are the sympathetic nervous system, it is imbalanced. It's very common to have also fatigue with anxiety, because they're kind of burning up their energy with nothing. And panic attacks are also very common with people who have anxiety. So panic attack is a very brief episode of very heavy, intense panic. In general, it's lasts for a few minutes. Some people it can last for a few hours, but generally it's more a few minutes. And people are completely out of control for a few minutes. They completely freak out. That was anxiety. Mania. So that's one that maybe many people are not very familiar with. We tend to say that people are manic when they're obsessed about something. But actually, the psychological definition of mania is completely different. So mania is a bit the opposite of depression. Depression is a low mood, lack of energy, lots of sleep, etc. And excuse me, and very low confidence, lack of behaviors, etc. Lack of social behaviors, etc. Mania is exactly the opposite. Mania is people who are full of energy, who are very happy, very high moods, very intense mood. Also, they sleep very little. They may have very strong ego, so they can tell you so many stories about what they did, their achievements, etc., or how amazing things they have done in their life. They also have a strong libido when they are in these manic episodes. And they tend to do extravagant purchases. They tend to buy stuff they don't really need, and they can't really afford, really. And that's funny because it tends to, so people who are in mania, they feel good. They feel really good about themselves. They feel really good about the world. They don't think there is any problem, right? Even though we can't see that they're not normal, like they're too high, they're doing too many things. They don't sleep. They do these extravagant purchases. They may be gambling or doing this type of stuff. So we can see that they're not normal, but they feel very normal. And that's why people who have mania, they don't consult people who have mental health practitioners. They generally don't do that. So when do we get to see them? Is first when they shift from mania to depression, because mania kind of always leads to depression at some point. You can't always stay in mania. You'll have to go through depression. So that's one thing. So we'll see them when they're depressed, and then we ask them also, have you had a period where you're very high, very happy, you were doing lots of things, etc. And some of them say yes. So that's mania, and it means that they may have bipolar disorder. So bipolar disorder, people who have mania and depression. The second category is when it's not the patient themselves who come to consult, but it's the family, because the family are fed up with them. They, maybe their libido is too strong, or they constantly talk about themselves and they're completely fed up with them, or they go and do some very risky behavior. They start to have fights with people, etc., etc. And then the family comes and bring the patient. All right, insomnia. Insomnia is an extremely common symptoms. The survey tends to show that around 50% of people have insomnia symptoms, so it's very, very high. Now we have to be careful about what insomnia means, because it can mean different things in different contexts. So usually when we talk about insomnia, we're talking about a subjective dissatisfaction with sleep, okay? So it doesn't really matter how long one person really sleeps. Like if we measure the sleep with our machine, it's not going to correlate very well with the subjective satisfaction with sleep. Some people objectively sleep very well, but subjectively they feel there's a lot of problem with their sleep. Some people have the opposite. They objectively have a lot of problem with sleep, but they actually feel very fine, don't feel there's anything wrong with them. So we have to be very careful. When we talk about insomnia, it has nothing to do with the objective sleep one person gets at night. It's about the subjective feeling of how well we sleep. And it's really about sleep quality. So a few things that can happen is either difficulty falling asleep, and the word difficulty here is very important. So you have to feel it's hard for you to fall asleep, like it's difficult. Some people they take a long time to fall asleep. It takes them half an hour or 40 minutes to fall asleep, but they don't feel like a difficulty. It's just what they do and they don't really mind. In this case, you can't count that as insomnia. It has to be difficult and annoying. Okay. Second thing is people can have frequent awakenings. So they wake up during the night and then they have difficulty to fall back asleep. Last one is early morning awakening. So waking very early in the morning and not being able to go back to sleep after that. Is there any questions about this, about the symptoms we've covered so far?
What?
Are there any questions so far? All good?
Yeah.
Okay, thank you. All right, there's a lot of other mental health issues that can happen. So one is obsessions. Obsessions is really about ideas that or images that come to someone's mind. But what is important with this is that the people who have these ideas and images in their minds, they reject these images and ideas. They want to control them. They want them to go away, and they can't because we can't. We just can't have images and ideas go away. We don't control our thoughts. So people who have obsessions, it's people who want to control their thoughts and control their ideas. And generally, it will be images about, you know, some filthy things, unethical ideas. And the thing is, we do, all of us, we do have some unethical, or not very, you know, a bit filthy ideas or images coming to our mind from time to time. It's just we don't act about them. We don't go and do these non-ethical behaviors. But we do have these ideas from time to time. We just we're quite relaxed about it. We don't stress out about these ideas. The people who have obsessions is people who stress out about that. And they want to control these ideas. Because they can't control these ideas, then they just become more and more upset about it, and it becomes a problem. And the fact that they want to control it, it makes it even stronger. Compulsion is a bit similar, but it's in behavior, so things we do, actions. Compulsions, it's generally actions that are about, you know, making up for the bad ideas. So for example, if people have ideas in their mind about contamination, about diseases, what they may do is wash their hands to get rid of the bacteria or the disease, etc. And they may do it repeatedly again and again. What some people have also very often is they don't know if they locked their door. They go back and check, and they just do it again and again because they don't feel confident about the fact that they really checked and it's really locked. So that's idea of example of compulsions. Hallucinations, I think a lot of people have misconception about what hallucinations are. Most of the time, hallucinations are not visual. Most of the time, hallucinations are auditory hallucinations. So it's voices. Most of the time, it's voices. And these voices, they tend to be also very specific. So it's human voices, and they tell something, and they tell a story. And generally, the story they tell is something very negative, very annoying, very disturbing. So basically what happens here is people who have hallucination, generally it's schizophrenia, they develop in their minds like a second mind that is outside of their own mind that will be very critical about themselves and will tell them very bad things. And because they don't want to keep that inside their mind, they make it become outside of their mind. All right. So that's an example of hallucinations. Of course, it's not always voices. It's not always self judgment and things like that, but most of the time it is. Now, delusions, it's ideas that people believe in 100%. Like, no matter what happens, no matter how the evidence is against these ideas and beliefs, they will continue to think that this is the only truth possible. All right. And generally what we do is we take religion outside of that. So if people just believe in God, and regardless of the proof, they know they're still going to believe in God, we don't consider that delusions. We just think this is a cultural thing, and there's nothing wrong with that. But delusions are more about people who think that someone is against them, or people trying to harm them, and they think the government is trying to harm them, and they think there's always someone who is watching them and trying to to do something, to spy on them, or to do something like that. Now, it's really important to understand that delusion is something irrational for the person, right? So if a CEO of a big company tell us, I feel there's someone spying on me, this is actually quite rational because there might be someone spying on them. There might be, another company or another country or something like that spying on them to try to see what they are up to in terms of decisions and stuff like that. But if someone who is a school teacher is telling me, oh, I think the government is spying on me, that's completely irrational. Why would the government spy on them? So that's why you draw the line. Okay, so let's talk a bit more about anxiety. So there's a specific type of anxiety called phobia. Phobia is about very specific anxiety. So it can be fear of animals. Some people are completely afraid of dogs, and they can't be around a dog. They will run away. Even if they see a picture of a dog, they will start to feel very, very uncomfortable, start to have palpitations and things like that. It can be spiders, it can be other things. It can be I can't think of lots of examples. It could be like taking the plane, or it could be a situation as well. So these are phobias, and they tend to affect people's life a bit less because they're very specific to a certain situation. So as long as people are not confronted to dogs or flights or stuff like that, they don't have any symptoms. It's really when they're confronted a certain situation. Social anxiety is when people start to be very anxious in some social situations, such as public speaking, or being in a meeting, or being even in a family dinner, or thing like that. Especially when they have to show themselves. So if they have to talk at a meeting, they might have social anxiety. If they don't have to talk, they may be very fine. Autism is another problem we consider in the mental health issues. So autism is really about having trouble to interact with the environment. Yes, social interactions. Conversion disorder is a very interesting one. Conversion disorder is people who have mental distress, psychological distress, maybe because of problem at home with their marriage or something like that. I think in China, a lot of kids having that because in their family they could not express their distress, their psychological distress. So what they do is they use bodily symptoms to express these disorders. And the cases I've seen in China were people who were stuck in certain position. Like, for example, they were with the legs open up, the legs open like that, and they were stuck in this position. So they were walking like this with the leg apart, and they could not change this position. It was like blocked, rigid. So that's an example of conversion disorder. But some people are like fainting. Some people, they have big dizziness episodes. It can be lots of different things, conversion disorders. But conversion disorders are a lot about not being able to express their mental distress. Somatization is a bit similar. It's also stress that will react on the body, but it's less impressive. It's generally it's like palpitation, chest pain, stomach pain, etc., etc. So it will be symptoms that are related with stress, but and physical symptoms. Attention disorder is something that we talk about more and more for children. So it's ADD and ADHD. So they tend to be very scattered. It's people who have their attention, they have very trouble to focus on one thing, and they tend to be hyperactive. They tend to react to stimuli around them very frequently and very strongly. And they do have difficulties to just calm down and be focused on one task. It starts in children, but it can just continue in adulthood in some people. Tic disorder, this is also a condition that affects mostly children. So tic disorder is about having tics or spasm generally in the face, and it's also related with stress and mental distress. All right, so we talk a lot about different things that can be mental health issues. Now let's make sure that lots of things are not mental health problem, and you should not be worried too much if you have that. The first thing is about being sad. Being sad is a completely normal thing, and there's nothing weird about it. Even if it's recurrent, if it's from time to time, as long as you're not stuck in this sadness all the time, most of the time. Okay. And generally, people who have sadness, they're also not completely stuck in their mind, having the same bad negative ideas coming back to them again and again. It will go away very easily. If something good happen to them, they can change them quite easily. Also, people who experience sadness, is generally there is a good reason to be sad. So for example, maybe today my friend told me something very bad about myself. I feel very sad about it. Or my I don't know, my friend went away for, we were staying together for 2 weeks, and then they went to do something else. And I miss them very much, so I feel sad about it. So again, there is a really good reason to feel sad. Depression is very different. Depression, you don't really see any good reason to feel depressed. I mean, any obvious directly related with the emotion reason. Okay, second thing is fear. So that's difference with anxiety and fear. We already talked about it. Fear, again, there is generally a very good reason to feel afraid. If I see a snake, if I see a spider, and they may really attack me, it's a possibility. I need to be afraid because I need to run away. Okay, that's normal. That's completely, people are supposed to have this sort of fear. If at work there is, I know there is cuts and people are getting fired everywhere around me, it's really quite normal to feel afraid about it, especially if you need your job to be able to sustain family or even yourself. And it will be quite difficult for you to find another job. So these are really good reasons to feel afraid, and it's good that people have this feeling. There are some people who have, for example, some brain injuries, and the secret that is related with fear is impaired. They don't feel fear. And these people, you might think, oh, wow, they should be super brave and they should be super successful then. They're not afraid of anything, but they have trouble for anything because they don't feel any fear. They take too much risk and they lose again and again. So they will make some stupid decisions all the time. And they can't have a normal life. They can't have a normal job. They can't have any of these. Okay. So it's important that we have this sadness and fear. Also, what is quite normal is anxiety, depression, and insomnia if it's occasional and if it's temporary. Okay. So if I feel depressed for a few days, even if it meets the criteria we talked about earlier, and then it goes away, Again, that's not mental health issues. They're just part of what happens to people. We sometimes feel anxious, we sometimes feel depressed, and we sometimes have insomnia. It's just the way our body functions. If it starts to be something that is most days, most of the time, and really affect your life, affect the way you function, then it's a problem. So same for these mental health symptoms that we talked about. As long as you don't suffer from it and you don't have any social impairments. So social impairment, what does it mean? It means that I can't do my job normally, okay? Or I can't be a mother normally. So if you can't do this, you can't have your social roles, achieving your social roles because of these symptoms, then this is a problem. This is definitely a problem. And we should manage it. We should try to do something about it. If you don't suffer from it and you can achieve your role quite well, you can work normally, you can you can be a mother, father, etc. normally, then that's okay, that's fine. It's just maybe one aspect of your characteristics. I've had some patients like that, especially when we were doing clinical trials. Because when we do clinical trials, a lot of people who are not sure if they do have a problem or not, they come to see us. And then some of them would say, well, you know, I always have a very low mood. I never really feel happy in my life. And then tell them, so what do you feel that's a problem for you? Does it affect you? Do you suffer from it, from having a low mood and not being very happy? Some would say, yeah, well, I don't mind really. It's not a big deal for me. It's just part of my life. And I don't know if I should, you know, think of it as a problem or not. And I ask them, so can you work normally? Can you do your family roles normally? And they say, yeah, that's fine. I can't do all of this without any problem. Then generally I tell them, so in this case, don't be worried about that. Just me, this low mood is part of the way your nervous system works. And you should not worry about this mental state because this might be just the way you are. And you should not try to, be happy all the time or be happy or be as happy as other people. There's not such a thing. Everyone is very different. So as long as you don't suffer from it and your social roles are fine, then you should not worry about it. Is there any questions about this aspect? All right. All right. So let's continue. Illusions. So illusions is a funny one. It's not hallucinations. Illusions is when you see things that are not real, but they kind of could be real. So it's like if there are some dots on the floor and you perceive them as ants moving around or insects moving around, and even if there are no insects for real, but you see them like this. So this is not really considered as a mental health issue. It's just something that some people have that, and it doesn't necessarily mean that there is something wrong with their brain. It's just the way things are. And generally, it's not non-emotional content. For example, ants, it's very neutral. It doesn't mean it's good or bad. But if you start to see something that is, if you see a person who is pointing at you and saying, oh, you are a bad person, then that's a hallucination, right? But if you see things that could be interpreted a certain way, but are not exactly the same as reality, then it's an illusion. There are also personality tendencies. So some people tend to be more worried. Some people tend to be a bit obsessive. Some people tend to be a bit, a bit manic, a bit very happy all the time, etc. As long as they don't suffer from it, they don't feel it's wrong. As long as they can achieve their role, generally we don't consider it a problem. From a sleep perspective, just light sleep by itself is not a problem either. We don't consider that someone who has a light sleep has a problem with sleep. Okay, as long as they don't have trouble to fall asleep, or they don't wake up frequently or wake up too early in the morning, we think it's fine. There's also the idea of non-restorative sleep, which is basically feeling very tired when you wake up in the morning. And this, again, according to biomedicine, this is not a problem either. Should not be considered as insomnia. Last one again, frequent dreams are not considered as a problem in biomedicine. But what people have found is people who have a lot of dreams during the night, remember the dreams, it's related with the emotion regulation strategies, which is basically saying this, where when people experience emotions, they should try to express it in some ways, right? But some people bottle up their emotions, and which is definitely very bad because it would only increase the emotion, increase the physiological aspect of the emotions. And therefore, these people tend to have lots of dreams. And dreams seems like a way to manage these unmanaged, unprocessed emotions that are accumulated during the day. All right, so let's have a quick look at some numbers. So these are the prevalence of mental health problems in the public, in the general population. So for clinical anxiety, we are about 7.3% of the population. That's a number from 2013. Depression is a bit more than this. So it's interesting because having symptoms of anxiety is very common. Lots of people have that. But anxiety that reach clinical thresholds is actually not that common, not as common as depression. Anyway, clinical depression is about 13% of the population. These are numbers a bit more recent, from 2018. The people who have depression symptoms, it's about 30% of the population. Okay, there's a distinction between having symptoms or having something that is clinical, which means basically it's a disease, right? Or it's a disorder. For insomnia, we are 10% if it's about disorder, it's a disorder, and 30 to 35% of the population who have symptoms. And some survey, I said it was in some surveys as much as 50%, depending on the criteria really. It's important to understand that during the pandemic, all these numbers increased a lot. So depression, we are about 20% instead of 13%, and anxiety, we were about 35% instead of 7%. So a big increase in anxiety. Stress was about 53% during the pandemic. In general, all these numbers for depression, anxiety, and insomnia are higher in females than in males. So that's something that has been discovered for a long time. And that aspect is not necessarily a complete consensus, but in general, it's seen that the prevalence of anxiety, depression, and insomnia are higher in high-income countries compared to low-income countries, but it's even higher in people with a medium income index, with medium HDI, so Human Development Index. So it's basically countries that are developing, that are in intense development, they tend to have even a higher level of mental health issues. And that's something I feel I realized when I was living in China, because I was living in China for 10 years. When China was really booming economically, I feel like lots of people had depression, anxiety, and stress problems. All right, so let's talk about the different interventions that can be used for mental health issues, what's good about them, what's bad about them, because I don't think there's one method that will be good for everyone, but we can learn about which one is better for which person. So this is just a cartoon showing the Gibraltar works best if you take it with water lapping near your hammock on a Caribbean beach. So it's just a funny cartoon showing that the drug might not be everything. So let's talk about antidepressant first. Antidepressants, we call them also anxiolytic drugs. So most of the anxiolytic drugs are antidepressant, but we'll see there's another category. They generally affect the neurotransmitters in the brain, which are mainly norepinephrine, serotonin, and dopamine. So the good things about antidepressant drugs is that we have quite good quality of clinical trials or clinical evidence, which means double-blind, randomized controlled trials. So this is basically when there are two groups, people are allocated to these two groups very randomly, and one of them gets the real drug and one of them gets a placebo, and they look exactly the same. So there's no way to know which one people are taking. This is a very strong quality of evidence, and we do have this evidence for most of antidepressant drugs. So that's a very good thing. Second thing is we know them very well in terms of mechanism. There's been a lot of research on how they work and what they do exactly to the body. So we know that relatively well. Another good thing about antidepressant drugs is they have been studied and they've been used for a long time, about I think more than 50 years, and in a large variety of populations, so hospitalized patients, outpatients settings, lots of different mental disorders. So we have a lot of clinical use of these drugs. They're very common in the clinic. Now, one of the disadvantages is actually we found that compared to placebo, they actually the efficacy is not big, it's not very strong compared to placebo. So we're going to talk about more about that, but basically what happens here is because people have a very strong trust about antidepressant drugs, they have a strong belief about it, and when they take a placebo that they think might be antidepressant drugs, they have a strong placebo reaction. So which means that because they have a very strong reaction to placebo, there's not much difference between the real drug and the placebo. I don't know if that makes sense. We're going to see that for herbal medicine, it's a bit the opposite, because people don't have a very strong belief in these herbal treatments. The placebo is not very strong. Therefore, there's a big gap between the real herbal treatments and the fake herbal treatments. There are some studies that show a lack of benefit for mild depression, and also there is lots of adverse events, including dry mouth, nausea, constipation, dizziness. One that is a bit annoying is sexual dysfunction, which is annoying for a lot of people who are trying to have active sexual life. There's also association with some risks. We have to be very careful about this association. These are things that are collected from the real world data. So basically following up people who have had antidepressant treatment in the past and trying to see how many of them have fractures, mania, etc., etc. And during these kind of studies, we found there's an association between taking antidepressants and a risk of fracture, also a conversion to mania, so making people in manic episodes, abortion, diabetes, and Parkinson's disease. Now, we can't know absolutely 100% for sure that the people have these risks because of the antidepressants. It's just that they found this association. Okay, so this is worrying, of course, but we don't know 100% why this is happening. All right, let's move on. Next slides. So this is about anxiolytic drugs. So another type of anxiolytic drug is sedative drugs, which are drugs that work on the GABA system. The GABA system is basically a neurotransmitter that inhibits the activity of our neurons, especially in the brain. So it basically reduces the activity. So this is very good for people who have a hyperactive nervous system, have very agitated, insomnia, etc., because it will calm down the whole nervous system. So one of the best advantages of sedative drugs is the relatively quick onset of effects. They're kind of straight away effective, whereas antidepressants, they usually take a few weeks. There's a relatively good quality of the evidence for anxiety disorder and for insomnia, although there may be a lack of evidence for other conditions. Now, one of the disadvantages is that they have adverse events, and people may have this hangover effect, so which may feel a bit drugged or a bit tired or somnolent during the day. There is as well an association with an increased risk of dementia, an increased risk of cancer, and an increased overall mortality rates, which are quite concerning. But again, with this, yeah, that's a good point. Some was saying, could everyone mute their put themselves on mute, and if you have questions, you can unmute yourself. But if you don't have questions, it would be good if you could all mute yourself so we don't have the background noises. Would be great. Yeah, excellent. Thank you. Thank you. Again, I like when there are questions, so feel free to ask them, even in the chat. You can ask your question in the chat. But if you don't have them, it's better to mute. Okay, in addition to that, there are some concerns about dependence issues. So it can manifest in different ways. Some people have tolerance, so then if they keep the same amount, for example, 5 milligrams of blah, 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 they don't have benefits anymore. They don't get benefits, or not as much benefit as they used to have. Another thing is rebound insomnia. It's when people stop taking them, they suddenly have insomnia again, or even stronger than it used to be. Withdrawal symptoms as well. So that could be fatigue, that could be dizziness, palpitation, or anything like that. Some study also show that it seems to not be better than placebo in the long term. And that's why, in general, these drugs tend to be used in the short term and not in the long term. All right, so let's move on. So the next one is psychotherapy. So we'll talk about cognitive behavioral therapy first. We'll take cognitive behavioral therapy away from the other type of therapies. The reason is because cognitive behavioral therapy is much more structured than the rest of the psychotherapies. It's also more, I would say, institutional in the sense that it's more taught in university. It's more accepted by governments in general. It can be reimbursed sometimes, and in some countries. They tend to be more research on cognitive behavioral therapy compared to other type of therapies. So one of the advantages of cognitive behavioral therapy is actually the good evidence that it's effective. It has a strong effect compared to usual care. So usual care is basically when we don't give any special treatment to people. We just have, if they have a cold, they may get some medicine, but we don't really give them any treatment for example, the depression or the anxiety. So we compare cognitive behavioral therapy to that. And of course, you can imagine that there's less placebo reaction when you don't give anything to people compared to if you give them a placebo drug. Does that make sense? Okay. One of the biggest advantages of cognitive behavioral therapy and psychotherapies in general is they are relatively safe compared to pharmacotherapy. There is almost no side effects, it's very rare, and there's no dependence issues. They don't really risk of dementia or cancer or anything like that in the long term. Now, the advantage of cognitive behavioral therapy compared to other types of psychotherapies, they are very well standardized. So we have a standardized sets of techniques that can be taught over a degree of a few years. And then it's relatively good quality. So we can pretty much be sure of the quality of the treatment compared to other psychotherapies. one of the disadvantages of psychotherapy in general, and that can be costly, especially if these treatments are not reimbursed. And then it's not always easy to find a therapist. It's not always accessible, and it can be time consuming as well. So session can be quite long, and you may have to come back again every week or several times a week to have benefits. Also, I think that something I found very important clinically is that psychotherapy is not for everyone. So some people just don't like it. They don't like to, go and talk to someone for 1 hour. It's not their thing. It's not what they feel good about. It's not what they want. They prefer something that can be ingested, or they prefer manual treatments such as massage or acupuncture. So it really depends. There is some research though that shows that people in general have a preference for non-pharmacological approaches. So it means they prefer psychotherapy compared to pharmacological treatments. Let's talk about other psychotherapies. So compared to CBT, which is very structured and very standardized, they're more flexible. They are more. They can be more adapted to individual preferences and to the needs of the people. And generally speaking, many people who are doing psychotherapy will do different kinds of psychotherapy at the same time. So they can just pick up whichever they think is more relevant to that specific patient. Same with CBT, they're relatively safe compared to pharmacotherapy, compared to drugs, really, compared to medication. One of the disadvantages of all the psychotherapies is when we do clinical trials and we compare them to CBT, the efficacy tends to be lower than CBT. So they tend to reduce symptoms less than CBT in general. Also, due to the fact of the lack of standardization, it's really hard to ensure that appropriate level of quality is here. So you may have one practitioner who is really good and another practitioner who is not that good. And it's hard to really maintain the level. There's also some sort of therapies such as psychodynamic. So it's really, Freud type of therapy with psychoanalysis, and sometimes they bring you back to your childhood and make you go through your trauma again on these sort of things. And some people start to question, well, if there are risks associated with that process to make people experience the trauma again and again, work on this trauma. So some people say that the therapy itself may be a traumatic experience. We don't really have that in cognitive behavioral therapy, which is pretty neutral in terms of emotional content. All right, so mind-body therapies, there are lots of them. These includes things such as meditation, yoga, tai chi, qigong, more modern versions such as mindfulness-based stress reduction, or even music therapies can be considered as mind-body therapy. All kind of relaxation, breathing relaxation, muscular relaxation, imagery and visualization. So there's a lot of different ways to use mind and body to treat people. So they tend to have a high safety. It's similar to psychotherapy. There's not many risks around because we're not ingesting a certain substance, right? So it's unlikely to create lots of side effects and it's unlikely to damage the body. What is good with mind-body therapy is there's a lot of different types, and it's much easier to adapt them to individual needs, right? So if some people, they like yoga, but they don't like Tai Chi, well, they can simply go and do yoga, right? They have the choice. And there's actually quite good evidence for some of the intervention, especially MBSR, so mindfulness-based stress reduction, has actually good quality evidence of the efficacy of these treatments. The evidence for things such as yoga and Tai Chi is a bit less than MBSR, but there is, it's growing. It's definitely growing, the evidence. Yeah, so again, so lack of good quality evidence for most of the interventions. One of the reasons of this lack of good quality is because it's very difficult to do some blinding, right? Blinding is basically if someone is taking a real drug or a placebo, you can make them look exactly the same. So in this case, people don't know what they're taking, okay? But you can't really do that for yoga and Tai Chi, right? Because you can't make something that looks exactly the same Tai Chi, but it's not Tai Chi. You could make people have another kind of intervention, such as psychoeducation sessions or self-reading, something about listening to music. But eventually it will not be exactly the same, and people will realize doing Tai Chi, right? If they listen to music or doing self-reading, they're obviously not doing Tai Chi, and they know about it. It's like you can't make them be aware of that. Another disadvantage of manual therapies is the effectiveness is actually not that high for most type of mind-body therapies. So some of them, especially mindfulness-based stress reduction, is very effective. Some of them, actually, the clinical trials show that the efficacy is not that high. This is Western herbal medicine. So there is some very good evidence for some of the treatments, such as St. John's words. There are also standardized treatments, so most of the time, Western herbal medicine, they are already prepared in some standardized treatments with a certain amount of blah, blah, blah. And they're relatively easy to take, right? It will be, for example, something you ingest, a few drops of something, or a few pills, or a few capsules. It's relatively easy to take. And they're generally quite safe when we compare them to biomedical drugs. They tend to produce side effects and risks a bit less than biomedical drugs. Now, disadvantages include poor clinical evidence for most of the Western herbal treatments. So we said there is good evidence for St. John's words, but it's pretty much one of the only ones for which we have very good evidence. For the rest, it's relatively poor evidence. Now, it has, I mean, you can consider it an advantage or disadvantage, but there is a low placebo effect because people don't really believe in Western herbal medicine that much. Excuse me. So generally, they tend to have this placebo effect a lot less than for antidepressants. So let's take it this way. If someone was to take a placebo and they were thinking they were taking antidepressants, they would get better much more than if they were taking a placebo and thinking this is herbal medicine. Okay, placebo effect is not as strong, which means that in clinical trials we'll see a bigger difference between real and fake herbal medicine. But also it means that for the population in general, they will get less benefits. Okay. Most of the time, for most of the drugs, St. John's wort is a bit of an exception again. Some other herbal medicine as well are a bit exception, but for most of the herbal medicine, the effectiveness seems to be a bit weak, and especially compared to antidepressant drugs. Now, let's talk about Oriental herbal medicine. So, I have a background of Chinese medicine, so I'm more familiar with this aspect of things. One of the advantages of Chinese herbal medicine or Oriental herbal medicine is that we can opt like individual treatments. We can adapt them to the needs of the people with their specificity. And we're going to talk about this today, right? We're going to go through the different characteristics of people who have mental health issues. And then there will be some strategies targeted to that. Now, the evidence, and that's, so this is a paper from Wang published in 2019. There is a paper that is not yet published, but we're trying to publish it on anxiety. That's showing that the treatment efficacy is actually quite good. And the evidence is actually quite good as well. So there are a double-blind control trial showing the efficacy of Chinese herbal medicine. One of the reasons why we have a better evidence for Chinese herbal medicine compared to Western herbal medicine is because the trials are done in big hospitals in China. So they have lots of resources to do the clinical trial. They can create placebo. They have lots of patients, so they can run trials quite easily. So they have more resources to conduct trial. In the West, because hospitals generally don't do herbal medicine, so there's less opportunity to run clinical trials, and especially good clinical trials. One of the disadvantages of oriental herbal medicine is it's difficult to do the quality control because treatments are all individualized, they're all different. So it's hard to maintain, to see exactly what is the quantity of each constituents, etc., and active ingredients in the formula and in the treatments. This is getting better because more and more now, instead of cooking the herbs, the raw herbs directly, we tend more and more to use what we call granules, and granules are a type of decoction of raw herbs that is then transformed into a powder, which is a bit like instant coffee that you can use just with hot water. And this we can standardize, and we can do quality control on this type of granules because they're produced by big companies, and they can run the tests and make sure the quality control is there. It can be difficult in some countries to access. I feel in Australia it's quite good. Australia is relatively easy to find the herbs, but in Europe, for example, it's much harder to find the herbs. One of the biggest disadvantages of oriental herbal medicine is they tend to taste and smell very bad. And if you're cooking themselves, so for decoctions, it takes a while to prepare it. It's quite burdensome. Also, another disadvantages of oriental herbal medicine is we don't understand enough about their mechanism compared to biomedical drugs. Biomedical drugs, we know exactly why they work, how they work. Oriental herbal medicine, we kind of know that they work, but we don't really know why. In a nutshell. So this is acupuncture. Acupuncture is also relatively safe if it's done in a proper setting with a proper clinician that was trained in all the risks and know how to conduct a treatment safely. The evidence seems to show that it may be more effective than antidepressant drugs, but it's not 100% sure. Disadvantages are that there's relatively limited quality of evidence. Again, because it's difficult to conduct blinding, right? It's very difficult to, especially for the practitioner, to make them unaware that they're doing acupuncture. Someone who is acupuncture, he knows he's doing acupuncture. You can't make them blinded to that fact. Another disadvantage of acupuncture is people generally will feel sensations when you put needle in them, and therefore they will, they may not be comfortable about these sensations. Another disadvantage is that the cost can be quite high. I know that in Sydney, some people charge more than $100 per session, and therefore it can be very burdensome for some people, especially if they don't have any cover. In Australia, lots of people have health funds and they will reimburse these costs. But if they don't have it, then it may be very costful. All right, so massages. Technically, they're relatively safe as well, and they also feel comfortable. So compared to acupuncture, maybe they're widely accessible in many countries. It's much more easier to find massage than psychotherapy or acupuncture. Well, I mean, it may depend. In some countries, it may not be the case, but in most countries, so far as what I've experienced, is that it's much easier to find massage than other things. Among the disadvantages of massage is there's not much evidence that they work for mental health issues. And again, the cost it may not be reimbursed, and the effectiveness might not be very, very high. Now, there are other things for mental health issues. We have art therapy, we have exposure to nature, which is something that we're kind of growing more and more the evidence about that, how important is for mental health exposure to nature, and how just by doing bushwalks and going to parks, we can actually improve our mental health. Gardening is also, again, it's rising. It's already being applied in the real world, but the evidence is just growing at the moment. That this is really helpful. Nutrition is also one big hot topic about mental health. The fact that by changing and improving our nutrition, we can help mental health be better. All right, so we mentioned lots of different types of interventions. Let's try to see how they compare to each other in terms of efficacy, all right? So when we compare an antidepressant to placebo, the effect is actually, so effect sizes, it's a measure that will tend to show you for different type of clinical trials, different systematic reviews, it's a standardization of how good something works. And it's always something compared to something else. And it's very hard to explain exactly what it means, but the rule of thumb is to say that effect size of 0.2 and above means a small effect, 0.5 and above is a medium effect, and 0.8 and above is a large effect. So it's basically 0.2 is okay, but it's not great. 0.5 is better. 0.8 is a good treatment effect. All right. So we found the difference between placebo and antidepressants, it's only 0.3. Again, one of the main reasons is that placebo effects of when people think they are taking antidepressant is quite high. CBT compared to usual care, so not really getting any intervention, is 1.1. So that's quite good. But again, we're comparing it to pretty much doing nothing. So it's not surprising that the effect is so good. Psychodynamic therapy, so it's a type of like Freudian type of psychotherapy. It's 0.7. So we consider it less than CBT. Interpersonal therapy, so it's a therapy that is based on a relationship with other people, with the family, etc. In 0.6, again, it's lower than CBT. Yoga compared to usual care is 0.7. It's about the same as the other types of psychotherapy. And Chinese herbal medicine compared to placebo, we can see these are quite high effect sizes, 2.1 basically. And this is for, sorry, all of these numbers are for depression, right? So if intervention for depression. Again, one of the things is people tend to not believe that much in herbal medicine. So the placebo effect of Chinese herbal medicine will be lower. And therefore the difference between the real stuff and the fake stuff will be quite big. Acupuncture compared to no treatments, the effect is 0.7. So we are about the same range as non-CBT psychotherapy and yoga. Intervention for anxiety. So this, I will see the treatment effect is generally a bit lower. Antidepressant compared to placebo 0.4. So that's the same thing. It's not very high. Sedative drugs compared to placebo, the effect is a bit better, 0.9. The CBT compared to usual care, this is 1.0. Again, we're comparing CBT, cognitive behavioral therapy, to basically doing nothing. So it's a large effect compared to doing nothing. Psychodynamic therapies, again, Freudian types of psychotherapy, working mainly on trauma, on these sort of things, in 0.6. It's lower than CBT. Yoga for anxiety, it's around 0.4. Mindfulness-based stress reduction compared to education, and the effect is 0.4. So you have to be careful here, right? So yoga compared to no treatments is really, it's basically including the placebo effect, right? But MBSR compared to education, it's kind of removed part of the placebo effect because we gave education to the other group. And now compared to the other group who had something, who had education, MBSR, in addition to that, on top of that, had 0.4 effect. Last one is Chinese herbal medicine compared with placebo. The effect again is pretty large, 1.4. That's the study we did on Chinese herbal medicine for anxiety. All right. Is there any questions on these numbers? I know it can be quite overwhelming. can be quite hard. So if you have questions on this, again, as I said, if you want to ask questions but you don't want to be in the recordings, I can edit you out of the recordings later. You can leave your questions in the chat as well if you want. All right, let's move on then. Okay, so the question at the end, so there's so many different type of therapies, and they seem to all work at some different degrees. Which treatment is really the best? That's the big question. I want to give you some example of my own clinical practice and what I've seen in China and in Australia. So this is a 45 years old patient who was treated with persistent insomnia, and we use cognitive behavioral therapy for insomnia. So cognitive behavioral therapy for insomnia works pretty well for insomnia in general. However, even if he followed the instruction pretty well, his sleep did not improve. Then we went back to a psychiatrist. Some psychiatrists suspected there was depression, and he started to give antidepressant drugs to these patients. Mark. After taking the antidepressant drugs, Mark's sleep actually improved a lot, and he became just better in general. He was more happy, he had more motivation, etc., etc. So that's an example in which cognitive behavioral therapy was not the best solution for these patients, and antidepressant drugs was the appropriate thing to do. This is a 24 years old patient who was treated with antidepressants and mood stabilizer drugs for an episode of depression because he had bipolar disorder. So bipolar, you remember, it's when people have mania and sometimes they have depression and sometimes they have mania again. Unfortunately, even if he was treated for 3 months, he was not getting any better, really. He was still quite depressed. And then he started to take some Chinese herbal medicine that I prescribed to him. And after 1 month, his mood was much, much better. And again, he was able to start to make decisions, which he was not able before that. His sleep improved, his physical symptoms improved. So it was the thing that was good for him at that moment. A 34 years old female who was very anxious. She wanted to get pregnant, but she was really struggling. She was making out efforts, and because she was very worried, this made her unable to get pregnant. All right, so it's a bit of a vicious circle going on here. She tried to do herbal medicine and acupuncture for years, for months and months, I'm not sure for years, but it didn't work, it didn't get anywhere. Then we started to work on psychotherapy. This was part of a clinical trial, actually. And after 2 months of going through this cognitive behavioral therapy treatments, her anxiety was much better, and she ended up getting pregnant. And then anxiety got even better after she got pregnant. So this is just a few examples to tell you that different people may need different sort of treatments. And that's just the way it is. All right, maybe let's have a little break. I don't want to give you too much information and get you completely overwhelmed. So let's take 5 minutes break, and we'll come back in 5 minutes to continue. We're talking about how people are different in mental health and the way Chinese medicine theory can help us to identify the differences and have an appropriate specific strategy for this type of people, that type of people. All right, so that's what we're going to do in the second part of this presentation. So see you in 5 minutes. All right, so let's continue if everyone is ready. So yeah, so in Chinese medicine, what we tend to do is breaking down things in what we call patterns, and these patterns based on clinical manifestations, so signs and symptoms that some people may experience or exhibit, and we classify them according to these. So these classifications have been processed through hundreds and hundreds of years. So people have made them better and better to be really not only sound theoretically, but also sound practically and clinically. So the first type of mental health issues is about what we call Qi constraints and constrained heat. So when we're talking about constraints in Chinese medicine, it's a lot about tension, right? It's our blockage and tension in the body. And it's also about excitement. So when we talk about heat in Chinese medicine, we can think about excitement, excess of energy, excess of activity in the body, and especially in the brain. So the causes of Qi constraint and constrained heat are really excessive emotions and stress. So again, we mentioned that having emotions, even if it's sadness or fear, are absolutely well. It's not a problem at all. But if you keep having them again and again, so this could be because you constantly have deadlines in your work, and then you have this fear coming back again and again. Oh, am I going to meet the deadline? Or I'm not, blah, blah. So that can be an excessive stress. Or if you have constantly fights with the people you live with or your neighbors, it can be also an excess of emotions, so excessive emotions. What I think is very important is also inhibition of emotions. So having the fight with the neighbors itself is not really a problem. The problem is when we don't have the fight with the neighbor and you actually think in your own head, oh my God, they're taking advantage of me. That's terrible, and they're so bad people, and I need to fight back, or etc., etc. Just keeping things in your head, and not expressing these emotions. I think that's very, very bad. And it creates a lot of tension and this type of constraint when we're doing that. Having very high moral, high standards, it can be good in some situation, especially if you need to be very good at your job or things like that. And it can make you be a perfect person, perfect husband or perfect wife, etc. But it has a cost, which is it will create a lot of tension in the body to have these high moral, high standards of the way you should be. I think another very important cause of constraint and stagnation is social isolation. So the way things work in the brain is that more stimulation you get from outside and you output to outside by speaking and acting, it kind of balances the tension inside the brain. But if you're not communicating with people and you're constantly keeping within your own head, well, things have to be boiling and stagnate and create this tension, this constraints, right? I think also another problem is lack of space. So it may not be very relevant in most parts of Australia, because we are very blessed to have lots of space around. But in some places, especially around the city, in big cities, but especially like in Asia, for example, that's a big problem. People don't have any space around them, and the fact they don't have that space can create some constraints as well. So that's in China, in Chinese medicine, we consider that the relationship between the body and the environment is very important. When the environment is stuck, we feel also stuck inside. I think colors also have a strong impact, and having more joyful colors such as blue, green, and red colors around will make you feel more enhanced emotionally. But type of grayish with a lot of white and black type of colors around will actually inhibit your emotions and feel actually a lot of constraint and tension in your body. When people have Qi constrained heats, They may feel anxiety, depression, they may feel irritable. So irritable is basically the chi constraints, the pressure inside the body is rising because of the excess of pressure and creating this anger. So there is a reason why people get angry. It's because they have sometimes there is a buildup of tension inside the body, and this rises and creates this burst of angers. Chest tightness, tension in the trapezius area, very common manifestation of tension, of chi constraints. Running pain on the side of the body, so this is 100% sure that there is chi constraint going on. Some people have a blocked throat, or stomach pain, or blocked stomach, like a stone in the stomach. Some people have a sign of heat, such as dry mouth, bitter taste in the mouth. They may have headaches, and they may have period pain and irregular period as well. So all of these are kind of sign of chi constraint heat. This has a lot to do with stress in general. Like it's you see that these symptoms that are related with stress. So it's generally the first stage of mental health issues. It's when there is very mild symptoms. So there's a little bit of stress, but it's not like something very severe or that could be even diagnosed of anything. And it's still relatively volatile at that stage. So you can get better quite easily. If something good happens in your life, then you may just all of this can completely disappear. Yeah, so we're going to talk about all the types, and the blood deficiency type, spleen deficiency, kidney deficiency can all lead to chi constraints and constrained heat, and can be the basis for this chi constraint heat to happen. All right. The chi constraint and constrained heat, you can think about it as a stress-related, mild form of mental health issues that may have lots of symptoms related with stagnation and blockage, right, in the body. This can further lead to more important blockage, which are liver fire, phlegm, and blood stasis. All right, let's give you an example. So a 45 years old female that we'll call Maria, of course, it's not her real name, requested a Chinese medicine consultation because she had neck and upper back pain. She also, later on, she revealed that she had anxiety and depression as well. But it didn't seem to be very, very strong, though. She was still able to work normally, to have a relatively normal life. So it was not a really, really bad, severe type of anxiety and depression. So she reported feeling anxious and depressed most of the time. Her mood was worse when there were stressful situations around, right? When there was a lot of deadlines at work, etc. She had chest tightness, shortness of breath, blocked throat, dry mouth, pain in the side of the body, headaches, muscle tension, and pain in the whole body, also period pain. So these are all signs of stagnation in the body. Her appetite was good, did not report any digestive discomforts, but had regular sugar and junk food cravings. Her sleep was actually fine. She tried antidepressants before and she felt drugs, so she didn't like taking them. And she saw that mindfulness interventions, such as yoga and meditation, were very helpful for her. She was exercising regularly and had a relatively healthy diet, despite the cravings. So we'll see that all these no discomforts, digestive discomforts, and relatively healthy diets, they kind of show us that there's no problem with the digestive or metabolic system, which could also explain her symptoms, but do not explain well in this case because she doesn't have any of this, right? Okay, so that was the first type, chi constraint, constraint heat. Second type is blood deficiency. So blood deficiency, from our perspective, it is not exactly the same as the blood running in our arteries and veins. It has a lot to do with the soothing aspect of the nervous system. And the blood deficiency is a lack of this stage. So it's a kind of nervous instability, which is related to a lack of nutrition, a lack of soothing of the nervous system. So reason that causes blood deficiency, so again, it sort of relates with the blood in the blood vessels, but not completely. It's mainly related with menstruation, with pregnancy, with breastfeeding, and menopause. So it's something that is relatively rare in males because they don't have any of these. And it's relatively rare in pre-menstruation menstrual females, so children, and people after older female after the menopause. It gets also quite rare after that period of the menopause. So it's really during the menstruation, because we lose blood, then it creates blood deficiency. In pregnancy as well, so we need to give a lot of blood supply to the fetus, and therefore it can create some kind of blood deficiency. And breastfeeding as well, the milk is considered a just processed type of blood, and therefore can create blood deficiency as well. The menopause period is also a period in which people tend to express some form of blood deficiency, but not always. Chronic stress, I think that chronic stress is a very, very important cause of blood deficiency as well. So stress causes Qi constraint and constrained heat. But chronic stress that comes again and again for years and years, this kind of creates blood deficiency, which makes basically the nervous system more unstable in general. Exposure to screen, I think, again, is a very important and rising cause of blood deficiency. When our vision is focused too much on the screens, it can actually impair our blood. And there is actually very interesting sources from 2000 years ago saying that if you watch something for too long, it will impair your blood. And of course, they didn't know 2000 years ago that people would have screens, but they realized that this could be something that will happen. Vegan diets, also that's the point that is a bit controversial, because there are lots of benefits of vegan diet. I'm not saying at all against it. I think it can be a very good idea. But for some people, especially people who have blood deficiency, we get our blood a lot from meat. And even though there are some non-meat food that can also be good for blood, people who have a purely vegan diet tend to have blood deficiency in general. We see that quite a lot in the clinic. All right, so people who have blood deficiency, they may not necessarily be stressed all the time, but they are vulnerable to stress. So when things happen to them, they tend to react quite strongly. They also have fluctuating emotions. So sometimes they're stressed, sometimes they're angry, sometimes they're happy. It changes quite a lot. They may have a light sleep and frequent awakenings, and especially frequent dreams, which is very strongly related with blood deficiency. The blood also nurtures the hair. It's not only about emotions. It also nurtures the nails. And it's also the source of the menstruation. So people who have blood deficiency may have dry hair and hair falling, dry and brittle nails. So that's a very strongly correlated with blood deficiency, and scarce and light-colored menstruation as well. It's quite obvious that this is something we will see more in females, because all the menstruation, pregnancy, breastfeeding, menopause cycle of what we were talking about. And we do tend to see blood deficiency more commonly in white-collar workers because of maybe the chronic stress that is impacting the blood level. I think also because the digestive system is not working as strongly as blue-collar workers. So it's very common that people who have blood deficiency, they're vulnerable to stress, right? So of course, we can't avoid having any potentially stressful situation in our life. Of course, there will be some. So generally, most people don't react too much to this. People who have blood deficiency tend to react. When they react to stress, they tense up. They create this excitement, this tension. So they develop heat constraints, basically. And this can result in Qi and heat constraints, right? Also importantly, if there is a chronic type of stress reaction, so chronic Qi and heat constraints, this will tend to lead to blood deficiency. So it's very common to see a bit of both in the clinic, people having blood deficiency constitution on the background and having some Qi and heat constraints. So Jo, 38 years old, has been depressed for 3 years following her divorce. She had a history of postpartum depression. And that's a very strong sign that there is something going on with the blood, because when people have childbirth, obviously they lose a lot of blood, and this tends to create blood deficiency, and therefore depression is very common. Very common. So in addition to taking care of her daughter, Jo had a very stressful job in finance, and she spent a lot of time on her computer. So we have a long-term computer exposure and chronic stress going on all the time, a bit of exhaustion as well with taking care of the daughter and having a stressful job at the same time. This lead to depletion of her blood, and therefore symptoms of lack of motivation and energy, but also feeling irritable, lead to neck tension, frequent headaches, dizziness, losing hair, which actually is very specific of blood deficiency. Constipation can also be a sign of blood deficiency. Blood is here for nurturing things, so blood deficiency can lead to constipation. But also light sleep and frequent dreams, which is again very typical. Her nails were dry and brittle, and her pearls were deep and thin. All of these are signs of blood deficiency. Okay. Her blood pressure was low and her iron levels was low, which is kind of objective signs that there was a blood deficiency going on. Now, it's important to understand that not everyone with blood deficiency will have low iron or low hemoglobin. Some of them will, some of them won't. And some people who have low hemoglobin and iron levels, they don't really have blood deficiency from our perspective. Liver fire. So liver fire is really about a hyperactive nervous system who is too strong. And the cause of this liver fire is substances such as alcohol, tobacco, and cocaine, etc., that are exciting. So it sort of excites the nervous system. Excessive consumption of warm and dampening food. So I know it can be a bit tricky to understand what dampening food means, but it's really dampening food is rich food, usually animal products, that tend to create stagnation in the body. If you want to know more about it, I have a video on diet, and I will explain more in detail about food that can create dampness. But basically, it's rich food that is quite hard to digest and process well. So red meat, cheese, and chili, which is very warm and hot. And also excessive and inhibited emotions can also lead to this nervous excitement, which we call liver fire. So people who have liver fire, they tend to be very angry and aggressive. So this is quite different from the constrained type of people who are more withdrawn within themselves, right? Liver fire, they tend to interact with the environment a bit more. They're aggressive, they shout, they lack of self-control, they do all kinds of silly things. They are very red eyes, red complexion. They may have dizziness, tinnitus, high blood pressure. So all this sign of fire rising in the body, right? But generally, this different between liver fire and constraints is that after the lash out, they get out this fire, they feel actually quite good. They feel better after it. People who have constraints, because there is stagnation going on, even though the fire is out, the constraints is not really solved. So they need to process their emotions, and they need more. Just lashing out is not going to help them to process the stagnation that's going on within them. Liver fire is much more common in males than in females. This has to do with the constitution, with food, with the fact that females tend to have less alcohol and tobacco, etc. So there are physiological and sociological factors. Liver fire can be caused by heat constraints, and also it can be more common when there is kidney deficiency. We'll talk about kidney deficiency later. All right, I'll give you an example. This is Haolin, who was a 34 years old male, generally healthy in general. But because of work stress, he had a lot of business trips. He started to have what we call a rise of fire. It's like inflammation symptoms of fire in the upper part of the body. So he was irritable. He was very agitated. Sleep was disturbed. So, very excited nervous system. He was frequently waking up during the night. He was dizzy, had sore and dry throat. He had also lack of appetite, distension in chest and sides. These are more signs of stagnation. So it's not pure fire, it's also a little bit of stagnation, of course. His tongue coating was yellow and greasy, and his pulse was wiry, which means it's very tensed. His pulse was very tensed. So you can see here already presentation, there is a little bit of constraint of stagnation, but there's a lot of fire, of excitation, of excitement, hyperactivity of the system. All right, so let's see another type that I think is getting more and more common nowadays is the spleen stomach impairment. So in Chinese medicine, when we talk about the spleen stomach, we actually talking about the metabolic and the digestive system. So saying spleen stomach impairment really means that the metabolic system and digestive system are not working very well. And therefore, with transforming substances in the body not very well, which obviously will cause some stagnation of metabolic waste inside the body. Okay. So what causes the spleen stomach impairments? It's really due to an imbalanced diet with a lot of sugar, gluten, animal products in excess, deep fried food, etc., etc. A common cause as well is eating dinner too late at night. The reason why, so this is because our digestive system is very low in the morning. It gets stronger and stronger during the day, and at night it gets also lower at night, and in the evening it starts to be weaker than what it is during the day. Okay, so if we have a lot of food or if we have food relatively late in the evening, when I say late in the evening, it's after 7 p.m. really. So we should technically try to avoid food after 7 p.m. if possible, because this will create burden on the digestive system because it gets relatively weak at that period of time. Snacking is also a common cause of spleen stomach impairments. Excessive quantity of food is obviously overwhelming metabolic digestive system, but also lack of exercise, which is extremely important nowadays. Most people don't exercise enough. Sitting for excessive periods are also very harmful for the metabolic digestive system, and overthinking, right? So this actually be just, it doesn't have to be some emotional thinking. It could be just work, right? Just normal work or studying too much. We use too much our brain. This can actually lead to impairment of our metabolic digestive system. So how do we know that there is spleen stomach impairment? One of the most important signs and symptoms in people with mental health issues is obsessive thinking. So obsessive thinking is thinking about the same thing again and again and again. So that's a sign very often of spleen stomach impairments. They can be insomnia. They can also be sensitivity to stress. So it's when people are vulnerable to stress, especially when these emotions are aggravated with lifestyle imbalance. For example, if they work too much, they don't rest enough, if they don't have a regular diet, if they get more stressed, you will think about spleen stomach impairment going on in the background. What else? So we have lots of digestive symptoms, such as abdominal bloating, loose and sticky stools. It can be constipation in some people. There might be lack of appetite or excess of appetite in some people. Cravings are also important in spleen stomach impairments. Also, I would say difficulty to gain weight and difficulty to lose weight are all related with spleen stomach impairments. These things are quite common nowadays. Lots of people have them. And that's why I'm saying I think this type of mental health issues is quite rising nowadays. There's also fatigue, especially if it's aggravated after a heavy meal and aggravated when the weather is humid. So these are all signs of spleen stomach impairment, which may also be related with what we call dampness. What we call dampness is basically metabolic waste stagnating in the body. And this will be aggravated if there is external dampness, which means a humid weather. All right, so people who have spleen and stomach impairment, generally the mental health problems will not be the main symptoms. It's probably more digestive type of problem. They might come with IBS, with diarrhea. They may come because they can't lose weight, or they may come because they can't gain weight. And then if you dig a little bit, they tell you, actually, I'm quite depressed. I have insomnia, etc., right? Spleen and stomach impairment are also very common in mental health problem in children. Well, the main reason is because children, first, they don't have periods, so they don't have blood deficiency. And they also not tend to bottle up their emotions, tend to express their emotions very directly. They tend to have constraints much less than adults. Spleen and stomach impairment can be aggravated by changing heat constraints, and it's very common. It will lead to phlegm and phlegm heat. We're going to talk about this later. Example is Leon. He's 40 years old male, and he had headaches. So again, you can see that people with this type of issues may not necessarily consult for mental health problems. In this case, it was headaches. And he did all kind of exams, and it was never found why he had these headaches. He was self-medicating with Panadol. He was an IT engineer and had to sit for very long periods. And he tended to overwork a lot, and had lack of exercise in his routine. So you can see that this is very common. People who have imbalance life-work balance and work too much, lack of exercise, they will develop spleen stomach impairment. His headaches will be on the forehead, which is related with the stomach, and it gets worse when he was hungry and when consuming sugar. Again, that's signs of there's something going wrong with the metabolic and digestive system. They were sometimes accompanied with nausea and palpitation, which is again a sign of dampness going on. He didn't have any chest tightness, dry mouth, or bitter taste in the mouth. You remember these signs were associated with Qi constraints and heat, constrained heat, right? So it didn't seem to be very stress related, but it seemed to be more digestive and metabolic related, right? In addition to that, he also had sleep disturbances, and he also reported feeling depressed a little bit. So he had a strong appetite, and especially craving for high-fat food like cheese. He had bloating, and especially when he had bread. He also had soft salt 2 or 3 times per day. So generally, when we have people with spleen and stomach problem, we'll see some kind of digestive symptoms going on as well in the presentation. All right, so let's talk about something that is a bit more severe. So we don't see this type of problem in the general population. We tend to see that more in really clinical population. So people who have clinical depression, who come to see their doctors because they are depressed and they feel anxious, etc. And they really need help, okay? So what we mean by phlegm really here is metabolic waste that is really dense, condensed type. We already mentioned metabolic waste. We tend to call this dampness in Chinese medicine. So it's really about, it seems to be related with metabolic waste, but it's not 100% sure. The only thing we know is that these presentations were associated with phlegm, and we also know that when we use phlegm transforming treatments, it can get better. So that's really what we care about. The causes of phlegm and phlegm heat are generally either the liver pathway, which is the Qi constraint pathway. It's basically excessive emotion creating Qi constraints. When it becomes chronic, so I should have explained that, but Qi, when we mean by Qi, it's related with the physiology of the physiological activities in the body. So it's really functional. It's not material, the Qi level. But when we talk about phlegm and phlegm heat, we're kind of talking about a more material level of things. Therefore, it's really a functional physiological type of problem leading to a more material, a more chronic and persistent type of issue. Okay, that's one possibility. The other possibility, it is more related with diet and life-work imbalance, and therefore this is a spleen pathway. It's a spleen stomach impairment, leading to at some point to phlegm and phlegm heat. So they are more phlegm heat. It's more persistent and severe. Low mood, anxiety, insomnia, obsessive thinking, disconnection as well. So that's something I found in the clinic that is really typical of phlegm and phlegm heat manifestations. Is people who have phlegm and phlegm heat, they kind of in their world, and they have. It doesn't matter what you tell them; it's not going to change the way they see things. So they may think, "Oh, I'm a total loser. I'm a complete loser." And it doesn't matter how much you tell them, no, you're not, you're a great person. I like you. I think you achieved lots of things. It's not going to change. They're not going to be on the same channel as you. They will be on a different level. Okay. The disconnection, I feel it's quite typical of phlegm and phlegm heat. The tongue coating, so that's the coating they have on their tongue, which is here. It's thick and greasy, or greasy. They may feel phlegm in their throat, and especially in the morning, they may need to cough out some phlegm, even if they don't have an infection. They may have stomach bloating, palpitation, nausea, vomiting, mind fog. They may have lack of memory and attention, and obesity. Okay. These mental health symptoms, compared to, for example, T constraints and constrained heat type, they're more stable and severe. Okay. They also may have more like type of weird symptoms. It could be, I don't know, something like I need to I don't know, I need to press on my head like this, and I feel more comfortable like this. And if I look, if I put my hand away, I don't feel comfortable. This might be something a bit weird that people don't really understand. So that's signs of phlegm and phlegm heat type of mental health problems. Generally, as we mentioned before, it comes from Qi heat constraints and spleen stomach imbalance, and it can also aggravate the Qi heat constraints if it's already there, if it's where it comes from, and maintain this constraint, stagnation. This is an example of John, who was 27 years old. He had severe depression, very low self-esteem, quite difficulty to make decisions. He had bipolar disorder and frequently experienced depression episodes, especially in the winter. So in addition to that, John experienced chest tightness, tension in trapezius area, a bitter taste in the mouth, palpitations. So there are signs of stagnation, but there's more than that, right? It seems to be quite severe. He felt constantly anxious, ruminated over negative thoughts. He also had lack of appetite, loose and sticky stools. His sleep was disturbed by nightmares, and his tongue coating was thin and greasy. So that's another very typical sign of phlegm type of mental health problem. The tongue coating is quite greasy. As a general rule, any type of mental health disorder, regardless of how severe it is, if the tongue coating is very greasy or very thick, I will always consider phlegm as a problem going on. All right, another type that is much less common in the clinic is blood stasis. So blood stasis is related with really persistent mental health conditions. It may or may not be related with our blood vessels. This is really hard to say. I think we need more research on that. I think it's related in some cases, but in some cases, there may be nothing wrong with the blood vessels, but we still call that blood stasis because this can be treated effectively by anti-blood stasis treatments. So the causes of blood stasis are generally chronic mental conditions, chronic physical conditions. There's also smoking, which is an important cause of blood stasis, but also aging. We tend to develop blood stasis just because we age. We see that a lot, I think more frequently in older adults, blood stasis type of mental health conditions. It happens also to younger people, but it's more prevalent in older adults. The symptoms are really persistent depression, anxiety, insomnia. There's also stagnation, so chest pain, palpitation, bodily pain. But what is more obvious and more specific is when people have a purple tongue, purple lips, purple nails, and also skin hyperpigmentations with dark skin or dark spots on the skin. So that's quite typical of blood stasis. Now, I must say that in the clinic, we often diagnose blood stasis type of mental health issues, even if we don't find these sign of purple tongue, purple lips, purple nails, but because it's persistent and treatment resistant. So when we tried this, we tried T stagnation based treatment, didn't work. We tried the phlegm type treatment, didn't work. Next step would be to think about, okay, maybe it's blood stasis, maybe it's why I missed it. It can be developed from T-heat constraints, and it's also aggravated as well. So you can see the T-heat constraints is really at the core of the pathological mechanism of mental health problems. An example is Yoann, who was a male, 72 years old, who came to the clinic. He was very withdrawn and he wasn't really talking too much. He was very quiet. And his wife was talking a lot for him. So the wife explained that Yoann started to be depressed because he lost his job 2 years ago. And he also had fatigue, memory loss, anxiety, irritability, lack of motivation, interest, hypersomnia. He also had back pain and cramps in the legs and was waking up at 5 a.m. in the morning. So far, we don't really have too many very specific signs and symptoms pointing to anything, right? But what's interesting, he had a history of hypertension. So history of hypertension, vascular disease, cardiovascular disease tend to show potential for blood stasis. Also, his tone was very dark, which is another very important sign of blood stasis. And he had congested vessels under the tongue, another very specific type of signs of blood stasis. His mouth was thin and wiry, which is not very specific. And his skins, lips and nails were all very dark. So again, another strong sign of blood stasis. Okay, another type that is again not that common in the clinic, and that is very different from everything else we just mentioned before. So it's called T and blood deficiency. It's really just a global lack of resources in the body. And we see that type a lot in cancer patients, who, especially people who have chemotherapy, for example, very strong resource consuming therapies. We see that also in women after childbirth, for example. So the causes are excessive bleeding, childbirth. It can be limited food intake. In the West, I think we don't see that. It's very rare to see people who don't have enough food, but it can be just because of anorexia. So people not taking food because of anorexia. Chronic digestive conditions, so people have enough food intake, but they don't digest it very well, and therefore it leads to our global lack of resources in the body. Also overwork and lack of rest, so we're consuming too much of resources compared to what we get in the system. The manifestations of Qi and blood deficiency are really signs of global lack of energy, global lack of resources. So it would be low mood, palpitations, insomnia, feeling easily startled. There is generally no agitation, so there is no fire, there's no excitement. That's really when you know it's very likely it's Qi and blood deficiency. Okay. So people may have this palpitation and insomnia, but they don't feel extremely stressed out about it. Pale complexion, dizziness, palpitation, fatigue. Also, the symptoms tend to get worse after exercise, and anemia can also be part of this Qi and blood deficiency. It's not always the case, though. We see Qi and blood deficiency more common in the female, especially after childbirth. I think the most typical cases I've seen in China, where so relatively young females who were very careful about their weight, so limiting their food intake because they wanted to stay thin. And they had a child, and they had childbirth, and after childbirth, they completely like broke down, and they had insomnia and all kind of palpitation dizziness and low mood. And this is basically because they didn't have enough resources in the first place to have a child, decided to have a child anyway, and after the childbirth, they just collapse. Childbirth deficiency generally, I mean, my clinical experience is limited in this area, but I feel it does not respond to antidepressant sedative drugs as the cheat stagnation type or phlegm type of mental health problems would respond. It's sometimes this develops from spleen and stomach impairment, but most of the time it's really a consumption of resources. Qi Hao was 32 years old female who came to our clinic because she had trouble falling asleep, and it started after childbirth. Her complexion was very white. This was very obvious when she came in the clinic. She looks exhausted. She said that her sleep was very light and she was waking up a lot during the night. It started after her baby boy was born 3 months ago. She was still breastfeeding during that time. So this is also something to keep in mind. Her qi and blood were consumed by the childbirth, but the breastfeeding is making it even worse because it's consuming her resources from inside, right? In addition to insomnia, Qi Hao was fatigued, she had dizziness with palpitation, her appetite was reduced, but she didn't have any discomforts. And she didn't really have any negative thoughts coming to her head. She was not thinking constantly, I'm a bad mother, I'm a failure, etc. And it's nothing like that. And she was not agitated, or she was not struggling emotionally, really. So when you have this lack of struggle and agitation, you kind of can rule out the qi constraints and phlegm and all these parts of the possibilities, right? Her pulse was very weak, her tongue was very large, which is all sign of lack of resources, sign of deficiency. All right, I think that's the last one. Yes, so that's the last one. Kidney deficiency with floating yang or floating fire. This is really an endocrine imbalance, which is accompanied with neurological excitation. So there is kind of a lack in the endocrine system, which paradoxically leads to a fake neurological excitation, which is not a real energy-driven excitement. So very different from the liver fire, which is excess type of problem. This is a deficiency, it's a lack, causing a fake excitation. Kidney deficiency is generally due to chronic medical conditions such as diabetes, hypertension, especially when it's been 15, 20, 30 years. It's also more common in older adults. It's due to a chronic consumption of resources. So we see that a lot in the clinic. People who have worked, overworked for 10 years, 20 years, working very, very hard, and they consume all the resources, they end up to have this kidney deficiency, even if they don't have the age at which we start to see that, which is about 60, 70 years old in general. There's people who have an excessive use of exciting substances and also excessive sexual life may have this kidney deficiency also earlier than when it generally happens. So instead of 60, 70 years old, it might be just 25 years old or 30 years old, if they have spent too much time partying, taking drugs, not sleeping, etc., just mobilizing the resources all the time. The manifestation of kidney deficiency with floating fire is logorrhea. So it's people who talk without being able to stop themselves. There is generally agitation, insomnia, so all this excitement in the neurological system. But also fluctuating mood. So this is a bit similar to the blood deficiency type. It's just that blood deficiency type, they tend to be more stressed, so it will be more stress-related problems like headaches and period pain. This is more like mania and depression and mania again, etc. There is this vulnerability to stress again. So we saw 3 different types of reason why we may have vulnerability to stress. One was blood deficiency, one was spleen and stomach impairment, and the last one is kidney deficiency. It's very common to see that around the menopause period. So people may have hot flashes, they may have hands and feet very hot or hands and feet very cold. They may also have lower back pain, they may have hair loss, reduced visions, and reduced hearing, so vision and hearing problems. We see that quite commonly in perimenopausal women and older adults. And I think, again, I don't have many cases, but it seems to me that drug addiction is history also leads to kidney deficiency. It seems also to me that it's more common in people who have bipolar disorder compared to depression. I think bipolar disorder is quite commonly associated with kidney deficiency, where depression is more associated with C constraints or heat constraints, with phlegm, and also with blood deficiency. The kidney deficiency can be developed based on chronic Qi constraint, chronic blood deficiency, etc., when they are for a very long time. Okay, so we're really talking about 15-20 years here. For a very long time, it depletes kidney, which is for us the most deeper level of resources of the body. Right? It's really the deepest level that we usually don't use up, but we can mobilize in some very extreme situation. Kidney deficiency can also lead to liver fire and to Qi heat constraint. It can be the basis. That's why we say people are more vulnerable to stress when they have kidney deficiency. And again, typical example is really perimenopausal women who I'm sure everyone here has some example in their friends or family who get really stressed very easily and get angry very easily and have trouble to cope with stress around the perimenopausal period. So Katrina, 54 years old, came to the clinic. She looked very agitated. So you see that's very different from the Qi and blood deficiency, which is just feeling down, lack of resources, but not really agitation. She was speaking very fast, jumping from one subject to another, and she seemed to have trouble concentrating. Okay. She reported history of sexual abuse when she was a young child, and she also survived war before coming to Australia. Katrina wetted her bed until late in her childhood. So that's another very strong sign of kidney deficiency. I don't really have time to explain why, but the inability to control urine is strongly related with kidney in Chinese medicine. So, but generally speaking, you can see that there is a lack of controlling things and concentrating and keeping things within constraint and control, which is very common in people who have kidney deficiency. She had a lack of motivation and energy. She had difficulty to stay present and felt stuck emotionally and cognitively, but she had no sign of constraint in the body. So no blocked throat, no chest tightness, no stomach distension, no bitter taste in the mouth. So we kind of rule out all the idea of Qi constraint and heat constraint. This doesn't seem to be the main problem here. Also, her appetite was good and she had no digestive discomfort. She had no feeling heavy or anything like that. So we kind of rule out the spleen and stomach impairment type of problem as well. She had hot flashes, which were worse at night, sleep disturbances, frequent awakenings, hair was thin and dried. She also felt dissociated and felt anxious. So all of these are signs of kidney deficiency. So here we see this really, this instability is really at the core of the clinical manifestations. All right, let's take again maybe a few minutes because there will be a lot of content. Sorry, my presentations are always very full of content. And I want to make sure you're rested enough before we move on to the next stage. So let's take again just 3 or 4 minutes and we'll move on and finish about how can we really make the health better, mental health better. depending on these different patterns. All right, so let's continue. Let's continue with the last part of the presentation. We'll work on the basis of what we just learned about different types. So maybe let's just run it through the different types of mental health problems again, and then we'll talk about what we can do about them. So you remember the first type was the T constraint and constraint heat type. So it's really about tension, stress, and nervous excitement, but related with tension. We had blood deficiency, which is a more background thing, which is a lack of nutrition and soothing of the nervous system, which make it vulnerable to stress. We have liver fire, which is very an excessive nervous excitement, so sign of strong excessive excitement going on. Spleen and stomach impairment was more about metabolic digestive system being impaired, and therefore making the people vulnerable to mental health problem is generally not the main issues. It's one part of the whole disorder they have. Flame heat, it's more related with more severe mental health problem, more persistent anxiety, depression, and mental health issues. Blood stasis is a more special type of mental health problem. It's when persistent and treatment-resistant conditions. It may be related with vascular system sometimes. Tin blood deficiency is another quite special type of mental health issues. It's really people who have consumed their resources and have a global lack of resources in their body. And generally, they may have mental health problems such as insomnia and palpitation, etc., low mood, but they won't be very agitated or very struggling emotionally. Kidney deficiency is something we see more commonly in older adults, but we see it sometimes in younger people who have chronic health conditions, also history of using substance abuse. And this is really about hormonal imbalance that leads to our general neurological excitation and instability, I would say, general instability. All right, what can we do about it? So the first one is about constraint, qi constraint and constraint heat. So the idea here is really to open up and liberate here. So how can we do that? The main thing would be being able to express emotions. And of course, we always encourage people to talk to their friends, talk to their family about how they feel, about their problems, about how they feel about things, especially when they feel oppressed. It's extremely important to be able to discuss with other people. Some people don't like to talk. Journaling can be a very good alternative to that, and it's safer socially from a social perspective. I think it should not replace completely discussion with other people, but it can be a good idea for some people. Counseling is really, there is no way to express your emotions with people around you. Counseling is always a good option, and the only problem will be the cost, but it's it's advantages and disadvantages. Art can be also a very good way to express emotions. This includes music, this includes poetry, or etc., etc. So it can be also liberating and opening as well. So it's good to cultivate positive emotions, because positive emotions tend to be more opening and liberating, okay? Negative emotions such as sadness and fear, they tend to make us constrained within ourselves and block ourselves. But positive emotions such as joy, even pride, can be quite good to move things around. The thing about gratitude journaling, gratitude journaling is about every day thing. Well, I'm grateful for my family to be around me and to be protecting me every day. I'm grateful to have excellent children. I'm grateful for having a good job, and etc., etc. All the things we're grateful for, we thank people for, because gratitude is a positive emotion and can be induced by ourselves. We can create it. Compassion training. So we know that in, for example, Buddhism, it's a lot about compassion. Compassion is, again, a positive emotion, and if we feel more positive emotion, we'll definitely feel less negative emotion. Affection towards people, sometimes we tend to forget that. We focus too much on what we want to have in our life and that missing in our life, and we just forget to focus on the affection we have for the people who live around us, because this could actually make us feel much better. So cultivating positive emotions, it's also very liberating and very good for people who are constrained heat. Exercise and physical activities such as exercise, running, swimming, etc. Are very good to liberate and open. It's generally better if we can get to the point where we're sweating, because from a Chinese medicine perspective, when we are sweating, we're opening the pores of our body, and therefore we're letting the pressure out of the body. if that makes any sense. But otherwise, if we don't get to that point, there will be still some benefits because we're moving our qi around the body. Dance and sexual activities are also a very good way to move qi around and open and liberate these constraints. Exposure to nature in general, I feel is important, very important way to again open and liberate. Especially if there is very wide space, which in the mind, if we have wide space around us, we also feel very unconstrained. And especially if there are blue or greenish colors around, right? So you see that people who have this type of qi constraint and constraint heat going on, a lot of them, if they go to the ocean, they will feel much better. And that's very easy to understand, because this move their qi around, and they have less constraint or less constrained heat going on. Also, other ways to move the qi in the body, massages and hot bath, hot shower, sauna, because it will move the qi in the body and also liberate, so move out the excessive pressure. Some essential oils can be quite good also to move qi, such as lavender and flowers. So it means just having flowers around the house. It can be a good way to move qi around. So you see that here we're not doing anything really strong in terms of management. It's very simple things that stress management strategies that will help us to have a more movement in our body and more changes and fluctuation, so to keep what we call qi movement pretty well. This is a method also very simple to use rose flower. I don't know if you can find it in normal supermarket, but I know in Asian shop you can find them. This is rose flower buds. You place 3 or 4 in a cup, and then you put it in hot water, and then you can drink the infusion. Very simple method. If you do that every day, it's very good for stress and moving qi in your body. Acupressure. So there are 2 points. One is on the wrist, so on the back of the wrists, and between the 2 bones here. So at 1/6 of the forearms, and so this is this point, and you just can press a bit like that, especially if it's sore. The other one will be on the legs. So the fibula, the bone that is on the side of our lower legs. So on the head of the fibula, which is at the top of the bone, there is a point which is called gallbladder 34. This point is also very good to move things around in our body and relieve the stress. So we can use them 2 minutes per point per side. So 2 minutes on the left, 2 minutes on the right, at least twice a day, especially when we feel very stressed. A few things about qi constraints. So antidepressant drugs can be very helpful, but sedative drugs, because they inhibit and they bring down, they actually inhibit qi movement. So they're not the best, right? That's what we see a lot in the clinic. So people who have qi constraints, they feel they have they feel calmer in the brain, but they also feel the emotions are still there. The stress is still there, and it's maybe even stronger. Active mind-body therapies, such as Tai Chi, progressive muscular relaxation, are better than just relaxing, calming things, because again, they're going to push down on the pressure, so they're not going to open the pressure. And that's really what we want, to move and open the pressure. So not too much inhibiting relaxation, more active things. Acupuncture massages also a very good way to move qi. It's better than herbal medicine, I think. I don't think herbal medicines are very advantageous for this type of mental health problems. Counseling is very good, so psychotherapy in general. Okay. Let's go back to Maria. I don't know if you remember, she had lots of bodily symptoms and lots of stress, anxiety, depression. Last slide, yeah. Passing on to the points. Oh, yeah, for the points. I can give you the slide if you want. Just send me an email and I will be able to give you the points. But feel free to take a picture if you want as well. Yeah. So one is on the wrist, and the other one is on the lower leg, and the head of the fibula. It's very easy to find them online, these points. So if you Google that, you will be able to find them. All right. So let's move on. Again, I'm happy to send the slides later. So Mario, so she had lots of blockage in her body, chest tightness, tightness on the sides, etc. So what we did is we did work mostly with acupuncture and gua sha. Gua sha is a type of kind of massage with a tool, scraping the body, and mainly on the upper back region to open up this area, to open up the tension. And what we call the liver and gallbladder channels, they regulate chi movement, so they're good to move things around. And also the Zhaoyang channel, which is also an opening function. Remember, we need to open things up. She also had herbal formula with herbs that were mostly moving and opening, such as purpurum root and cinnamon twigs. After 3 weeks, she was less anxious, less depressed, and her upper back pain was reduced. She also felt less stress in general. She was just more positive in general. It's quite relatively quick response because, again, T constraints is not very severe. It's in the initial stage of a problem. I mean, it's in this case, this is a patient who had this problem for a long time. But when I saw her, it was on the mild stage. It was not very severe. I'm not saying she never experienced some more severe stages, but when I saw her, it was pretty mild. So blood deficiency, so it's this lack of soothing of the neurological system. What we need is really to nurture blood. So avoiding anything that will consume the blood, such as chronic stress, actively, also if there's bleeding, it has to be actively treated, especially for excessive menstrual bleeding. Like a lot of people don't really do much about it. I think the thing is in biomedicine, there's also a lack of effective treatment for that. So a lot of people just don't treat them, but we should treat them. Avoid having too many stimulant products such as tobacco, alcohol, recreational drugs. They can consume blood. Very importantly, limit exposure to screens. That a lot of people have too much exposure to screens, and instead have more exposure to green and blue colors. Okay, so more going out, more going to the ocean, to the mountain, etc. Important to get enough rest, especially during the periods, during pregnancy and during breastfeeding. This is extremely important in Chinese culture in general. Some foods such as spinach, red foods such as carrots, also Chinese red dates, pumpkin, beetroot, red meats can be very good for blood, so to nurture blood. Berries such as goji berries, blueberries, strawberries, raisins can be also quite good to tonify, nurture the blood. Think also about black beans, so sesame. So these all are a black type of food. They tend to be good for blood deficiency. Black bone chicken. I don't know if you heard about this. Feel free to Google it. It's a chicken that has white fur but black skin and also black bones. Bone marrow can also be good to nurture blood and essence. So this is a very easy recipe. We can use goji berry and red dates. This is something, it's very tasty, so just feel free to do it at home. If you think you have blood deficiency, we use 3 red dates and 8 to 10 goji berries in a cup with hot water, and you can just drink it, refill as much as you can. Okay, this is really good just during and after the period to nurture the blood again when there is this blood deficiency. Antidepressants, they tend to dry up the blood. They tend to move things around, but they dry up. So it's not ideal for people who have blood deficiency. On the long term, it may not be necessarily a good option. Psychotherapy, sedative drugs, they can control symptoms, but again, they're not really nurturing the substances. So in the long term, they may not necessarily work. Mind-body therapies are actually better because they tend to nurture a bit more, they tend to bring down the energy and create more blood and essence. Acupuncture is okay, but it's not as effective as herbal medicine because herbal medicine is more substantial. So it's better on nurturing blood as a substance. So Joe was a person who had blood deficiency problems and recurrent stress problems and headaches, etc. So she took a decoction with herbs including angelica root, red dates for 3 weeks. She started to feel less depressed and less irritable. Her mood was more stable in general. Constipation and headaches were also improved. She was also more relaxed, open, and happy, and again, less vulnerable to stress, which is really what we want to do with people who have blood deficiency. Okay, liver fire. Again, it's about excitement, excess, etc. So what we want is to calm down and bring down this excess. So we really need to avoid stimulant, exciting substances, and also find more functional way to expel pressure. So instead of shouting against people, going in the nature and have a big shout is a really good way to get rid of the excessive pressure. I have a little story about that. So in China, there's actually a lot of people who go to the park very early in the morning, like at 5 a.m., something like that. They go to the park, there's nowhere there, and then they shout for 10, 20 minutes. And what they're doing is they're really letting out of all the pressure they have within themselves, and also rising their energy for having a good level of energy during the day. So that's a good example of shouting, right? But when you're shouting at people because you're in traffic and blah, blah, that's a bad way of expelling the pressure. Moderate to high intensity exercise can be excellent. And of course, communication is a better way to expel pressure than just shouting and fighting and things like that. Avoiding very rich foods such as dairy product, red meat, sugar, and spices because it stagnates and create more pressure and can build up on the pressure. Also have more green vegetables, which will be cooling, and fruits, which also will be very cooling and more bringing up the fluids aspect of the body, etc. Drink more water. Chrysanthemum lily flowers can be very good in infusions for people who have excessive fire. Relaxation can be quite counterproductive because there is some excess going on, so the people are not able to relax very well, and therefore they get frustrated. So instead of trying to bring down and calm, etc., we need to let go of this excess of fire, right? Psychotherapy can also be useful, and acupuncture can be helpful as well. But I think herbal medicine will be stronger at draining and calming down the fire, and bloodletting is also an extremely good way to get rid of this excess of fire. Okay, so what happened to Harlin, who had this, work trip, and he got very keyed up and had lots of insomnia and was very super hyper excited, right? So he got a Chinese herbal medicine prescription, and the herb contained mineral products. So mineral products, they tend to bring down and cool down. Also cold herbs such as Romania roots, Shen calming herbs such as sour jujube seeds. And after 2 weeks of treatment, Harlin was less irritable, his sleep was better, and his throat also felt better. So less fire in his body. Okay, spleen stomach impairments. Remember, it was a lot about digestive metabolic functions. So what we really want to do with people who have spleen stomach impairments, reinforce their digestion and metabolism, and avoid any burdening of these systems. Okay, so avoid dairy products, especially cheese, which is quite burdening. Cook the vegetables and avoid raw vegetables, especially if you're using watery vegetables such as cucumbers, tomatoes. We tend to think that they have a cold nature, which is not good for the digestive system. Avoid food in the evening or late evening, and avoid snacking. Reduce sugar and gluten consumption. I don't think it's possible really to completely avoid sugar. Gluten is relatively easier to avoid completely, but I think for most people, even if there is spleen stomach impairment, there's not necessarily need to completely avoid it. It's just to reduce it as much as possible. Limit raw fruits because they tend to be very cold in nature again, and cold tend to harm the spleen and stomach. Dried fruit and cooked fruit are actually better. I know it's not very in the tradition in the West to do that, but it's actually steamed fruits are actually very good, very tasty, and they're much better for health. Animal products, especially red meat and eggs, again, we're talking about limiting them, not at all. I think we always need a little bit of these animal products, but not having too many of them. Sitting not for too long periods, try to walk around every now and then, and also have regular low to medium intensity exercise. So we're not talking about high intensity exercise because we're not trying to let out the excess of pressure, right? We're just trying to make things moving so we can process metabolic waste and food better. I think that vitamin B and probiotics can be useful, but I'm not an expert on that, to be honest. But what I would say that I think that tonic such as ginseng, manuka honey, royal jelly, I know they're marketed as tonic to give you more energy. But if the energy is due to the fact that your digestion and metabolic system are weak, these things are actually quite hard to process. So it's going to overburden the system even more. They are too heavy, right? So it's not what you need if your digestive and metabolic system are not working well. Intermittent fasting, I think, is an excellent way. Very cost effective. It doesn't cost anything. It usually reduces your actually cost in terms of grocery, and it works very, very well. All right, so generally, I think the mental health issues that are related with brain stomach impairments do not respond very well to drugs, medication, and they don't really work. Psychotherapy is not working extremely well with that because it's not targeting the metabolic and digestive systems. Lifestyle changes are much more important, and we can also use herbal treatment acupuncture to supplement these lifestyle changes. It's mainly about diet and exercise, these sort of things. This is formula. This is the ingredients for a porridge made of millet, Chinese dates, and Chinese yam. These are ingredients that will strengthen the spleen and stomach and make you able to transform more the metabolic waste. So do you remember Leon? He was having headaches and he had this depression going on for a long time, but it was kind of underlying background thing going on. So we did mostly acupuncture with him. So on the spleen and stomach channels, which are the ones that are related with digestive and metabolic system. He also had herbs that were really reinforcing the metabolic digestive system, such as dry ginger, and also waste transforming herbs such as Pinellia rhizome. After 6 weeks of treatment, so you see this is a bit longer because this is a more chronic type of function, physiological function being impaired. The headaches were much better, and also his sleep was better, and he did not feel as depressed as he used to be. The phlegm-plague, you remember, it's more severe type of mental health problems. So if it comes from qi and heat constraint, which is a majority of the cases in the context of mental health, we'll have to use qi and heat constraints related lifestyle recommendations. So these were the opening moving, qi moving type of recommendation that we just saw here, these ones. So about liberating and opening. If it comes from spleen and stomach impairment, you will have to use more diet and exercise related strategies. All right. So it depends where it comes from. You have to see where the problem started. In addition to that, I would say that people who have phlegm-plague, generally it's relatively severe. So at this stage, we need some sort of medication or intervention. It can be psychological intervention, it can be psychiatric drugs, it can be herbal medicine, but we need something relatively strong. There is an infusion of tangerine peel that can be a bit useful, but again, I think we need something stronger in general. So it can respond pretty well to pretty much anything, but it's also generally more difficult to treat than just a simple Qi constraint or heat constraint. If we use just acupuncture, mindbody therapy, and counseling, I feel in general it's not enough. So we need stronger therapies. All right, so John, who had this severe depression, was treated with qi-moving herbs such as Bachelor roots and Imachal Bicha orange, also flame transforming herbs such as dried tangerine peel. And after 1 month of treatment, John felt much better. He had more energy, felt happier, he had fewer rumination because he was always thinking about negative things. And after 2 months of treatment, he started back to his normal life and he felt generally well. So you can see that for this type of situation, we'll need a bit longer treatments. 2 months will be really the minimum in order to get real remission. It's common that it will be a bit longer than that. Blood stasis, so we can apply all the recommendations for Qi heat constraints, especially the physical exercise, because when we're making things move around in the body, it will be good for moving the blood. Smoking and vaping is very important to stop because these are important causes of blood stasis. I think a little bit of digestive and red wine can be good to help move blood. Again, it's not about having 5 drinks per day, every day, etc., but having once in a while, just having a digestive once a day, or one drink a day, I think it can be a good idea for moving blood. Beer would not do that at all. So beer would completely be useless, but a bit of digestive, a bit of red wine, I think they can help a little bit. Onion, ginger, wood ear, garlic, and hawthorn, the 5 types of food that are known to move blood. They can be good to put in the food and have them. Hawthorn, it's a fruit that is more common in China, or maybe in Asia in general, but you can find it relatively easily in Chinese shops or Asian shops in general. Blood stasis, it's harder to treat, it's more persistent, if you remember, so it takes more time to treat. I think herbal medicine is better than acupuncture. Gua sha cupping and bloodletting can also be helpful in the process. This is a formula with safflower flower. We can just take in infusion with some hot water. It's very easy to make. And again, you can find this relatively easily in Asian shops. So Yoann was the guy who had this withdrawal. His wife was talking all the time. He wasn't saying anything, very withdrawn. So he was treated with blood-moving herbs such as angelica roots and peach kernel. Also some spirit calming herbs because he had a lot of insomnia, these kind of things. We also gave him acupuncture, and after 4 weeks of treatment, his mood improved. He had also more energy. Very interesting. He didn't mention that in the first time, but after 4 weeks of treatment, he said, "Oh, actually, I feel my tongue is becoming softer," and it's actually a very strong sign of blood stasis when the tongue is very stiff. Okay, very rough, very stiff. So I didn't target that in the treatment, but this is something that improved through the treatment. I must say that it's not a complete success for this case. He still had quite a lot of symptoms after the end of the 4 weeks. He had to go away, to move out of the country, etc., etc. But it's quite common in terms of blood stasis that the treatment take a long time because, again, the nature of the disease, it's quite persistent. Now, Qi and blood deficiency, you remember, it's about a lack of resources, sometimes due to childbirth, sometimes due to heavy bleeding, etc. Okay, so the main thing to keep in mind for Qi and blood deficiency is really resting enough. So people who have Qi and blood deficiency, they have to stop working crazy. Ideally, they have to stop working completely and just rest for a few weeks. Enough time so they can bring back the resources. Getting enough sleep, very important. And tonic substances are quite good for them as long as they don't have any digestive issues. Okay, so manuka honey, raw jelly, ginseng, all these are quite good for people who have Qi and blood deficiency. They tend to abuse coffee because they don't have enough energy. They want to work, so they use up abuse coffee and energy drinks to mobilize the resources. But this is not supplementing the resources; it's mobilizing them. So it increases the deficiency of resources. Okay. Animal proteins, the chicken, prawn, eggs are actually quite good to build up the Qi and blood as long as they digest it properly. So same thing as the tonic substances. Chinese dates, longan, Chinese yam, mushrooms, goji berries are all very good food to supplement Qi and blood. These type of problems respond quite poorly to psychiatric drug. Psychotherapy is not doing much difference either because it's not stress related, it's not emotion related, it's really a lack of resources. It's biological. So acupuncture is not also very great. But moxibustion is quite good. Moxibustion is using some mugwort leaves to burning them and creating some heat therapy on the body. All right, so a Qi and blood production massage we can do is using this point, stomach 36, which is located just below the knee, 1 centimeter below, 1 centimeter lateral to the protuberance of the tibia bone. If you check stomach 36 on Google, you will find 200 pictures that will show you where it is. And you can find even a website that will tell you in details how to find it. Massage this point every day, a few times a day, for a certain period will help to build up the Qi and blood. Okay, so Qi Hao was treated for her insomnia with CBTI and insomnia, cognitive behavioral therapy, and herbal medicine, sorry. Oh, so CBTI and I forgot what was the other one. I think it was maybe acupuncture. And she responded poorly to this intervention. It didn't really work very well. Then herbal medicine was added to the treatment plan, and that's when the treatment started to kick in. Okay, and she started to get better. Her energy increased. She also had more motivation. So she needed the substances from the herbs to have more Qi and blood and therefore get better. All right, the last type of problems, the kidney deficiency. I don't know if you remember, it was really about hormonal imbalance, hormonal deficiency, leading to a sort of fake like instability and fake excitement of the nervous system, which is not a manifestation of excess of resources, but actually a deficiency. So meditation and Zhaoyang, so it's a kind of exercise that you see on this picture on the right. You can also Google it, and I created a video to explain how to do exactly this this technique, Zhaoyang technique. These are excellent way to bring down the excess back to the lower part of the body where we need to keep the resources in. Okay. Getting enough sleep is very important for people who have kidney deficiency, and avoiding stimulant products such as coffee and alcohol, because they kind of mobilize the resources from deep down and bring them into a superficial level. But this is definitely not what you want if you have kidney deficiency. Limiting sexual life and nightlife, because both of them, they consume the essence, which is the mobilizable energy deep down in the lower part of the body. Nuts and seeds, berries, sesame, black beans, bone soup, and stews are really good to build up the essence. So it's really rich type of food, right? What we want rich stuff. Chocolate and fennel, if you feel very cold. So these type of food, chocolate and fennel, they tend to build up the yang, right? When we talk about chocolates, it's I'm always emphasizing that we want to have a high degree of cacao chocolates, because otherwise it's just sugar and it will just burden our digestive system and metabolic system. So what we want to have a high degree of cocoa. If people have hot hot hands and feet. This is it's a more a lack of fluids in the body, a lack of yin in the body. So we want to consume milk to build up the fluid part of the body. Food baths can also be pretty good, especially before bedtime, because they bring down all the energy from the top of the body to down in the lower part of the body. And that's really what we want in kidney deficiency. Build up the lower part of the body and reduce what's happening in the top. I think people with kidney deficiency type mental health, they benefit a lot from mind-body therapies, such as meditation, Tai Chi, yoga, and also from acceptance and mindfulness-based type of psychotherapy. Okay. I think that herbal medicine can be quite good, and moxibustion, which is again the use of mugwort leaves to create some heat and stimulate some part of the body, can be quite useful for this type of conditions. Another trick from China, it's using a herb called evodia, so it's wuzhuyu, evodia fruits, and grind them into powder. So you create a paste. The second one is not to form a powder, it's to form a paste with honey, water, or alcohol. And then put this on a gauze and stick it at the bottom of the feet, which will warm up the feet. And you can leave them for 4 to 8 hours. If it's burning or itchy, you have to remove it before, otherwise you can have some reactions. And this will bring down the excess of fire that is floating in the upper part of the body, will bring back to the lower part of the body, which is what we want really. Be careful, because herbal patches can lead to allergic reactions, and some of the marks that they leave are kind of semi-permanent. So if you don't want to have that on your feet, you may not be able to do this technique. Okay, so let's talk again about Katrina. You remember she was very unstable. She had these hot flushes, these perimenopausal symptoms, and her mood, she was not grounded at all. She was very unstable in her mood. So she used mainly herbal medicine with rich kidney tonic herbs, such as prepared Rehmannia roots, goji berries as well. And we did also some session of hypnosis. And after 4 weeks of treatment with herbs and hypnosis, she felt more grounded and also less anxious in general. She was more able to concentrate and also achieve things she wanted to achieve. All right, so the conclusion of this very long presentation, well, that's all intervention for mental health issues have advantages and they have disadvantages. There's no one single intervention that will work for everyone all the time. Okay. Chinese medicine, because it has a very long theory, it was developed through thousands of years of clinical practice. It gives us a lot of tools to be able to understand and manage the differences between people who have mental health issues, and to try to understand what's really going on in terms of mechanism. Our experience is that many people can benefit from a natural medicine, and that's also what the research is showing. It can be effective for many people. All right, before we jump to the questions, these are my details. So I have a YouTube account called Dr. Yoann Birling, and this, you can just scan this QR code, or otherwise just search Dr. Yoann Birling on YouTube and will find me quite easily. Have lots of videos about health and how to get a better health. Mostly about Chinese medicine, but some of them are more psychotherapy related. I also have a background in psychology and psychotherapy. So most of them are health in general. I have 2 clinics, one in Westmead and King's Cross. If you're interested in having a consultation, or if you know someone who needs help, you can contact me. This is my email and my phone. There is a clinic where I work in Westmead, which is called acupuncture pregnancy clinic. This is really for pregnancy related situations, but if you know people who need help from pregnancy, it can be IVF or even when they are pregnant. And if they need some help, they can go on this website and find our contact.
My name is Yoann Birling. I'm a clinician, lecturer and researcher in Chinese medicine. We're going to upload videos on health, Chinese medicine and psychology weekly, so please subscribe to the channel. Like this video if you did like it, and take care.